As new COVID cases decline across the country, more Americans are heading back to the doctor's office. But for some, all those skipped appointments during the pandemic created serious health risks. Here's CBS's Dr. Jon LaPook.
It's one more troubling consequence of the pandemic: delayed medical care. 4 in 10 Americans put off routine or emergency visits in the first half of 2020, sometimes with devastating results. A year ago, despite having a heartbeat irregularity called atrial fibrillation, Eric Masella felt healthy.
And then COVID happened. My kid was home, so kind of stress built. Doctors weren't available, so I hadn't seen a doctor for a while.
What's a while?
Oh, probably a year.
Last fall, he developed a persistent cough and fatigue. COVID was ruled out. By January, he could no longer ignore his symptoms. His heart function was so poor, some organs started shutting down.
Kidney failure, liver failure, cardiac arrest. I died. They were able to get me back, and once they did, I was on life support for the next 3 days. Push, 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 push.
At 45, with a nearly 2-year-old son, Asher, he had heart failure. In the U.S., emergency room visits last spring for heart attacks and strokes decreased by about 20%. And worldwide, cardiac diagnostic testing decreased by 2/3.
Because of COVID, there's such a hesitancy and such a fear to going to the hospital.
Mount Sinai cardiologist Dr. Anu Lala helped Masella recover.
The message that I would urge people to take home is do not ignore your symptoms. Take the time to check in with yourself.
What do you think when you look at Asher now?
What could have happened if he didn't have a father? And that still scares me, but I'm safe now.
And Dr. LaPook joins us now with that important message. So, Dr. LaPook, what are some of the appointments that people really need to make sure that they keep?
Anything to do with preventive medicine. Norah, a lot of us feel that we're emerging from a form of hibernation. And as we do that, it's important to reestablish connection with our primary care providers and talk about screening tests for things like heart disease and cancer. Tests like mammography and colonoscopy precipitously dropped about a year ago with the onset of the pandemic. Now, they made a comeback, but they really haven't gone back all the way. And the head of the NCI, the National Cancer Institute, has warned he's afraid that in the years to come, there's going to be an increase in excess unnecessary deaths, cancer deaths, because of screening tests that were missed during this past year.
Wow, important information. I know I've made a habit to try and just get my preventative visits now. Thank you.